Okay.
Can you see my screen?
Yeah.
Okay. So which is most important for a preconception class?
History.
Hello.
Hello.
D.
The importance of taking adequate vitamins and minerals. Why?
And minerals. No, not minerals.
Potential risk. The importance of the use of OTC drug with no, let's read it. Let's read into the description. Risk factor.
Well, what's the problem with conception? This is preconception. So what kind of things do we have to consider if we're going to conceive a child?
Oh, the importance of healthy lifestyle.
Okay, it was the use of OTC drugs with teratogens, okay, because they have risk factors for adverse pregnancy, all right? Smoking during pregnancy, consuming alcohol, not taking adequate folic acid, being during pregnancy, being obese, taking prescription drugs. We also have to worry about immunizations as well. Taking prescription or over-the-counter drugs that have known teratogens, have a pre-existing condition, can negatively affect pregnancy if not managed. So again, if you just took this preconception, okay, teaching, see if it brings it to us. And that was what chapter? 12. Yes.
So the cleaning people are gonna come.
Okay.
But if you leave before they come, just set the alarm.
Okay.
Yeah, I'll see you Monday.
Okay. Okay, page 359. Okay, and it's really going to tell you here the things that you need to talk to that patient about for that preconception teaching. Okay, 27-year-old female was just confirmed to be pregnant. She tells the nurse she just switched to a vegan diet. The nurse explains that she must pay special attention to her intake of which elements to ensure she is getting adequate nutrition for her and the baby. Select all that apply.
So D.
Iron and folate.
Okay, yeah.
That's it?
Yeah. No, not okay.
Okay, protein,
Calcium.
iron, vitamin B, and calcium. Vegans do not include any meat, eggs, or dairy products. Pregnant vegetarians must pay special attention to their intake of protein, iron, calcium, and vitamin B12. Remember that for the vegans, right? The body doesn't produce certain amino acids. So they're going to have to get those from some sort of intake.
Okay.
And again, if you go here, let's just see. Changing nutritional needs, okay? Right there, page 385. You see how quick that popped up?
Yeah.
You can't go wrong using this method. I'm going to tell you that. You can't go wrong. It's only going to make it easier for you. And then it tells you exactly what you need to include. It's a beautiful thing there. I wish I would have had this stuff when I was in school. Okay. When assessing the effectiveness of obstetrical regional analgesia received by a client, the nurse recognizes it is successful by the complete loss of pain sensation at which level of the spinal cord. Now remember, okay, as you go up the spinal cord, the numbers go up, right? Well, where is L1, L2?
Is at the neck.
L1 is lumbar.
Okay.
So L1 is going to be at the bottom of your back, right?
Yes.
And then it goes up, L2, L3, L4, L5, whatever it goes up to. And then we start with the thoracic region, right?
Yes.
So then we have T1, T2, T3, and then it goes up to the cervical region. Okay, so now I'm saying that to you because I want you to envision, where do you think that level is going to be stopped at? Because we're talking about obstetrical regional analgesia. So we're talking about maybe some sort of spinal or something like that, right?
Yeah. So T1, T2. Isn't 2x is
Now, if you're not sure, let's look. Let's not guess. It's going to be in here somewhere. Okay, here it is. Regional anesthesia provides pain relief without loss of consciousness involving the use of local anesthetic agents. Okay, obstetric regional analgesia generally refers to a partial or complete loss of pain sensation below the T8 to T10 level of the spinal cord. Page 508. A beautiful thing there, huh?
It's 508. Okay.
So now where does this go? Obstetrical regional anesthesia. Where does that pain loss sensation usually stop at?
T8?
Below the T8. Okay.
Okay.
You could do this with pediatrics also, by the way.
Okay.
A nurse is caring for a woman in labor and understands that as the fetus travels through the birth canal, the fetus makes positional changes. List the cardinal movements of labor in the correct order that the nurse would expect the fetus to move. All options must be used.
Okay.
Okay.
So which one happens first?
Let's see. Will it be the flexion first?
Extension,
No, flexion.
flexion. I'm not sure. I don't know how I just did that, but it looked like it moved up. Oh, I guess I have to pick it up and move it. Okay, flexion first. Blonde here. Okay, what's next? Well, we're gonna put expulsion last for now.
Yes.
Okay.
That thing, I forgot it already.
Any idea?
No, not this one.
Okay, well, let's look.
Yeah, I'm looking at it. Okay, okay, I can do it now.
You got it? All right.
It's the,
What page are you on, Hermes?
no, oh, I'm looking at another little book that I have.
Oh, okay.
Yeah, it's the, that's a mechanism of action. Let me see, where is it at? Where is it? So it's expulsion last. External rotation before last. I have it now.
What page are you on?
No, it's just I'm looking at it
I
on
think she's using a different book.
Okay. Okay, let's see. Cardinal movements of labor. Here we go. Page 465. Okay. Looks like engagement, descent, flexion,
and internal
internal
rotation,
rotation,
extension,
external rotation, and then expulsion.
expulsion. Yeah.
Okay, so engagement is going to be actually at the top. And then what do we say? Flexion,
Flexion,
internal rotation,
internal rotation.
extension, and expulsion.
Yes.
Ladies, you good with that?
Yeah.
Yep. Explosion.
Okay, and that's correct. So you want to know that.
Okay.
EFII. We're going to engage, we're going to flex, we're going to rotate, we're going to extend, and then we're spitting that baby out.
Okay.
Okay, you guys got the page number for that?
Yeah.
What page is it again?
467.
467. Okay.
And it actually starts around 465, according to my resource.
65.
Okay, a client calls the clinic asking to come in to be evaluated. She states that when she went to bed last night, the fetus was high in the abdomen, but this morning it feels like it has dropped down. After asking several questions, the nurse explains that this is probably due to what?
Lighting.
Yes. Lighting D.
Good job. Lightning. That occurs when the fetal presenting part begins to descend into the pelvis. The uterus lowers and moves into a more anterior position. In primiparas, lightning can occur 2 weeks or more before labor begins. With multiparas, it may not occur until labor. When the nurse is assisting the parents in the grieving process after the death of their neonate, what is the nurse's most important action?
Keep the communication line open. You have to communicate with them. Let them know what's
Okay.
going.
Good job. You always have to communicate with your patient and let them know, talk to them, offer them support.
Nurses
The nurse, go ahead, you can read it. I'll be glad for you to read it.
conducting a presentation for a group of pregnant women about condition that can occur during pregnancy and place the woman at risk. When discussing blood and compatibility, which measure will the nurse explain as most effective in preventing isoimmunization during pregnancy? That would be the Wogan.
Okay, and when do we give that ROGAM?
We can give it while we're doing the amniocentesis. You can give it when the baby is born, when the mother has an abortion, when they have a stillbirth, things like that.
Okay, why? Why would you do it during all those times? What's the major indication for it?
For blood and compatibility.
Okay, whenever there's a chance that the blood of the moms and the baby will mix, with one is negative and one is positive, we always are going to have to give that. So typically we would give this right before or right after the baby's born, but we're also going to do it in the amniocentesis because during that procedure, there's a chance for mom and the baby's blood to mix. That's the part I want you to hear and remember.
Okay.
Okay.
Anytime that mom and baby's blood has a chance to mix, we have to give that. If one is negative and one is positive. Okay.
So that was correct, Ms. Sue?
Yeah. Oh, yes, I believe that was correct. We didn't check the answer, right?
No. Okay.
The cerclage is for cervical insufficiency, and it doesn't matter what your blood type is. It's what your blood RH is. Okay.
A pregnant client. No, you want to read Lovetta or you want me to continue?
Yeah, I already. A pregnant client has tested positive for heavy virus. When discussed, sorry, I'm using my phone and the screen is
Okay.
really small.
I'll continue. When discussing the situation with the client, the nurse explained that her infant should be vaccinated with an initial HBV vaccine dose, at which time within the 12 hours of birth. And I believe the next dose is gonna be 1 month. Okay, I'll go with the 12 hours for now.
Okay. What about you, Lavita? Do you know this? It's okay if you don't, because I want to know now, not come exam time. We want to know now you don't know it. Okay, here you go. Page 764. If a woman tests positive for HBV, hepatitis B, expect to administer the HBIG. The newborn will also receive HBV vaccine within 12 hours of birth. The second and third doses are given at 1 and 6 months. Page 764. Okay, there you go.
In preparing for a class for a group of pregnant couple, the nurse include information about smoking and possible complication associated with it. Which complication will the nurse most likely include? So I know smoking can give spontaneous abortion, maternal hypertension. It wouldn't be high birth weight, it would be a low birth weight. And it would be there's another one I saw.
It wouldn't be A also, or no?
It would be no premature. Oh,
Do you want A, Levita?
Yeah, we can do A.
abortion placenta. Abortion placenta.
Can we look that up, Ms. Sue?
Sure. Okay, page 780.
Okay.
Spontaneous abortion, tubal ectopic pregnancy, preterm labor and birth, fetal growth restriction, stillbirth, premature rupture of membranes, low fetal iron stores, maternal hypertension, placentia previa, and abruptio placentae. So I think the only one you're missing is premature rupture of the membranes.
No, it's not a.
But it said that.
But the question is not.
The question's inaccurate. I'm going to take the question as inaccurate because it says premature rupture of membranes, okay?
Yes.
The author says that, so I'm going to say that that's correct. And I actually wanted to pick that answer. I want to say I picked it before, but I never looked it up in the book. But now we know that that's a correct answer.
Okay.
Okay, page 781. And you can actually fight that because it's right there in the book.
I don't know if it's.
The 26-year-old female G1 P0 presents to the emergency department reporting regular uterine contractions. Examination reveals that her cervix is beginning to efface. The client is in her 36th week of gestation. The nurse interprets the findings as suggesting which condition is occurring.
Preterm labor.
So preterm.
Precipitate, preterm, dystocia, normal.
Preterm.
Okay, preterm, yes. Sorry, I read again. I'm used to having classes of people that don't want to read.
Okay, we read.
I would rather you guys read.
A nurse is preparing a presentation on current American trend in maternal morbidity and mortality in order to lobby for program funding. Which statement will the nurse include? Select or not apply. Okay, E look good. Most pregnancy related to
Most of the pregnancy.
experience are not preventable.
Most pregnancy.
40, I think the United States, 48. Yeah, B.
B as in boy?
Yes, each year, 100 to 200 women die. And A. That's all. You see anything else, Loretta? I think that's all from my reading.
Which one?
I think that's it. That's each year.
Just B and E.
Okay, so
Yeah.
Let's see if we can pull this up.
So pregnancy.
Okay, so this is on page 8 in your book.
Chapter 1.
Chapter 1, page 8. Now, you see, sometimes you can't find a topic that you're looking for. So what I did with this question, I just pulled out of that answer down there at the bottom. The United ranks 48th. That's all I put in there, ranks 48th. Because I know that's not going to be in any other terminology in the book. And that brought me right to that insert. So sometimes, you know, if you're looking for something you're finding hard to find in the book, try to find something in the answer or in the question that sticks out that you can plug in there that'll bring you to that topic. Most of the time, you'll go right to the topic. But there are sometimes a little difficulty finding something. All right, who's reading?
It is important that couples
Okay.
practice natural form of birth control. Understand that the mucus secreting gland of the cervix can store live sperm for up to, is it 36 hours?
It says it says
36 hours?
40.
I'm not sure.
I think it's 48 hours.
48
I'm not 100%
hours.
certain on this one, but for some reason, 48 popped in my mind.
Yeah, I'm thinking 48 too.
But I'm not always right on these. You know, OB's not my specialty. I can get you through it. It's just not my specialty.
I would just want to get through it, Ms. Sue. It's a lot of stuff. Yeah, 48 hours. Yeah.
Okay, 48 to 72 hours. So
a woman is undergo labor induction. The nurse determines that the woman is likely require cervix riptin if the Bishop score is 5.
Good. A score less than 6 usually indicates that cervical ripening method should be used before labor. So it's not ripe enough at 5, at below 6, okay?
Mhm.
So when the cervix is ripened under 6, it will need a special fix before you can induce labor, okay?
Okay,
When the cervix is ripened under 6, it will need a special fix before you can induce labor.
okay.
Under 6.
Under 6.
Okay.
After teaching the health education class on the female reproductive cycle, the nurse determined that the teaching was effective when the group identified which phase as belonging to the ovarian cycle. Ovarian cycle has I have it in my book. Ovarian cycle is
Wait, what
follicular
was the
phase.
question?
Follicular phase.
Yes. A.
Follicular, yeah.
Okay. Follicular phase, ovulation, and luteal. And this also, if you go to this page, it's going to tell you about the whole way that pregnancy occurs in there. Page 103. Okay, right here, ovarian cycle, 3 phases, follicular, ovulation, and luteal.
How often contraction occur? Measure from the beginning of the one contraction to the beginning of the next contraction. Would
A
it
D. Frequency.
D as in dog, frequency.
Yeah.
Okay, good. Duration is how long it lasts, and intensity is the strength.
a nurse see a pregnant client at the clinic? The client is close to her due date. During the visit, the nurse will emphasize that the client get evaluated quickly should her membrane rupture spontaneously, based on the understanding of which possibility. So if the membrane rupture,
Spontaneously.
that would be a risk for infection.
Okay, good. Those protect us, right? Those membranes. Once they rupture, you definitely have to get checked.
A.
Okay, you also have a risk at that point for cord prolapse. What would you do if that happened?
It's called, if the cord prolapse, you put the patient on the side and you try to push the cord.
So no, you can't push the cord.
You want to lift the
You have to
baby.
put the mom in a transverse position so that you're not putting pressure there, right?
Yes.
You can't push the cord back in for sure. So you have to try to relieve pressure there, and you do that through positioning.
Okay, that should be easy. First semester will be urinary frequency. It will be breast tenderness and nausea.
That's it?
Urinary
A.
frequency, A.
Final answer?
Yes, final.
Yeah.
Okay, good. Backache, leg cramps, second semester.
A nurse is reading a journal article about the use of real-time ultrasonography, which allowed the healthcare provider to obtain information about the fetus. The nurse will expect the article to describe which type of information. So sonography. This
Um, the-
sonograph. What do we do there?
this-
Is it chromosome abnormality? No, it's a view in a picture. The defect treatment, the size and shape of the placenta, but why? Obtain about the fetus, the size and shape about the placenta. Let's look at it.
Can we look that up?
Nursing intervention.
Let me see what chapter this is. 12. Okay, page 412.
Page 412.
Hi.
I thought you was on vacation.
I'm back.
You came back yesterday?
I came back last Saturday.
Or you was not here all week?
No.
You was here-
Well, I was here Wednesday, Thursday, Friday. No, Wednesday and Thursday, not Friday. No, not Wednesday because we had snow, right? So I was just here
Yeah.
Thursday.
Yeah, you came in one day. I was gonna ask you, but you was talking to the girl.
Oh yeah, it was Thursday I came back.
Yeah.
Yeah.
Well, I'm here.
Okay.
I gotta do the bathroom thing in the front end.
Okay. I'll probably only be about another half hour and then I'll be getting out of here. All right. Sorry, guys. Okay. Ultrasonography, page 412. Did you find it? So in the first trimester, to confirm pregnancy, exclude ectopic fertilized egg implants or molar hydatidate moles and confirm cardiac pulsation.
Okay. 412. It's on the bottom of
Provides
page.
information about fetal activity, growth, gestational age, and fetal well-being. Determines the need for invasive intrauterine test.
Size and shape. No, the effective order. Lowest.
Biophysical profile.
Okay.
Why is it
All right, so fetal movements, fetal tone, fetal breathing, amniotic fluid volume with or without assessment of fetal heart rate, All right, the chromosomes are done through the amniocentesis. The placenta may be observed, but it's not the focus.
Okay.
So probably if you look up the biophysical profile,
Mm-hmm.
So it's
you
this.
might get more information that way. Let's see. Chapter 12. So page 418. See it right there, biophysical profile uses ultrasound to allow assessment of various parameters of fetal well-being, including fetal movements, fetal tone, fetal breathing, ultrasound assessment of amniotic fluid volume. The same thing we just read in that. Rationale, page 418. Okay, who's reading? Did I lose you guys? Hello?
Sorry, I'm reading and
Hello?
sorry. A woman who is 18-week gestation is at follow-up appointment regarding the positive test result of alpha fetoprotein testing. Which will the nurse suspect with the positive result? So you will have Down syndrome.
Yeah.
Good. So now you can look this up either way, under Down syndrome or under alpha fetoprotein testing.
When you go on the question like this, it look like, okay, I don't know what's going on in the exam.
I might have spelled it wrong.
It's together.
Fetoprotein.
Yeah, it's together.
$357. Okay, common lab test and diagnostic test on page 357. Are these the kind of tests you're seeing on questions you're seeing on your tests?
Yeah.
Yeah. When assessing a woman with ectopic pregnancy, the nurse will suspect that the tube has rupture based on which finding? Vaginal, no.
But no.
I think it's the shoulder pain myself.
Shoulder, with her shoulder pain, yeah.
And why is it that? Why is it?
That's what
referred
happens. You get
pain?
that referred pain.
Okay.
It's caused by the phrenic nerve irritation from the tubal pregnancy. There you go. There's your answer right there. And I would just type in referred shoulder pain, because if you put in ectopic pregnancy, you're going to get a bunch of stuff back. But that's really specific for that. What chapter were we there? 19. Okay, lower abdominal pain with dizziness accompanied by shoulder pain, ruptured ectopic pregnancy. What's your patient at biggest risk for here?
Okay.
Huh? Say it again.
No.
What-
We're
What
just
was your question?
I said, what is your patient at biggest risk for here when they have this ruptured ectopic pregnancy?
Hemorrhaging?
Yeah, but then that is going to lead to what?
Is it-
Shock.
Shock. Okay.
Okay.
Yeah.
All right. I'm going to leave you guys with this book because you can go through this on your own and do some of these questions. I want to go through some other, just some stuff just to try to beef up your knowledge. And it may not necessarily be questions that you might see on the exam, but it should help beef up your knowledge a little bit on OB. And hopefully it will.
Okay.
And then Hermesis, we got to get together so I could show you how to use the book. You know how to use the book the way I'm showing her how to use it?
No.
Okay, so we got to make sure your book is registered so you can go in and use the book the way I'm showing her how to use it. You could still go in your hard book and highlight the stuff, but
Yeah,
this is
I can-
just so you can find it quickly, so you're not going through the book searching for everything.
Okay. That would be too maybe for future reference. You show Lovetta already?
Yeah, but I could still show you before we log off.
Okay, okay, thank you.
All right, can you see my can you see my screen?
Yes. The clinic nurse is reviewing the plan of care with a client who has PKU and plans to become pregnant this year. Which statement from the client required the nurse to intervene? Okay, I will consume more.
Now, one thing I like you guys to do is when you see stuff like this, okay, you read a question like you're reading the questions in your book. If you don't know what PKU is, then you need to look it up. If you know what it is, tell me 5 things about it. Tell me 6 things about it. Pretend I'm sitting in the room and I want you to tell me 5 things that you know about this and how it affects the patient. If you can't think of 5 things, think of as many things as you can and go through that. And the more you brainstorm like that, the easier it's going to be for you to answer questions. Okay. So PKU, what do we know about that? What is the problem when someone has this disease?
It's genetic. Is it genetic?
So they're born with this disease. They can't process protein. So they have to eat a specific diet, okay? Because if they don't eat that specific diet, it's going to cause retardation or damage in the brain, okay? Now, this client is planning to become pregnant. All right, so it's asking which statement from the client requires a nurse to intervene, okay? So let's talk about number 4, because I like to read from the bottom up. This way I don't miss anything. My baby will need to have adequate milk intake after birth to help ensure the screening test for PKU is adequate. It would be beneficial for my partner and I to have genetic counseling, even though he does not have PKU. I will have to use a special low phenylalanine formula for infant feeding if my baby is also diagnosed with PKU. I will consume more high protein, iron rich foods such as meat and eggs before and during pregnancy. Okay, which ones can we get rid of?
We can get rid of.
We can get rid of one,
We
right?
can get rid of.
We can get rid of one because if she has PKU, we do not want her doing that. Right?
No, because
Well,
the question said require the nurse to intervene.
Yeah.
So one will be.
Okay, you're
They were
paying
looking for the
attention.
wrong answer.
You're paying attention.
Yeah.
All right, nurse. I'm the NCLEX devil. You know that, right?
Yeah.
Okay.
You are trying to trick us, Ms. Sue.
Okay. So the other statements are probably true then, huh?
Yeah.
All right. So they don't have this enzyme that's required to process or metabolize phenylalanine. And this is an amino acid that comes in protein foods. Okay. And if they don't process this phenylalanine, it's going to cause them to be intellectually delayed or mentally retarded. It's going to cause a brain growth problem. All right. In the beginning, the baby has to build a little bit of a level of this in order for us to detect that they're not. So once the newborn is born, they may have regular formula or milk, but once they determine that the baby has PKU, and remember, we do that hill stick within the first, I want to say 48 to 72 hours, okay, to see if they have this.
Oh, is it PKU too? I thought it was vitamin K.
Before 24 hours.
Okay.
Okay, they take a couple of drops of blood from the newborn's hill. Now, we're also giving vitamin K right away too. Why?
Clotting. They don't have enough.
Clotting factors, right?
Yes.
Okay, go ahead and read.
The nurse is caring for adolescent newly diagnosed with chlamydia infection. After administering a 1 dose of azithromycin, the nurse understands that which of the following client statement indicate a correct understanding of client teaching. Okay. A long-term consequence of untreated chlamydia infection is infertility. Yes, that's true.
Yes. Mm-hmm.
I can resume sexual intercourse tomorrow as I already received the antibiotic. No, that's not true. You got to get treated first. You can transfer it.
Okay.
I can
I
still
said
spread
3,
the
yeah.
I can still spread the infection even though I do not have any symptom. That's true. I should have screening
I'm
yearly.
not sure my pockets. So 5.
I should have screening for chlamydia. Yeah, we'll make sure my partner get treated for, yeah.
Final answer?
Yes,
Yeah.
and correct. We miss number 4.
4. I should have screening yearly.
Chlamydia is the most common sexually transmitted infection and is diagnosed frequently among women, adolescents, and those with multiple sex partners. Many clients are asymptomatic or have minor symptoms, spotting after sex, dysuria, abnormal discharge, but can still transmit the infection. All sexually active women less than 25 and anyone greater than 25 at high risk are screened annually for chlamydia and gonorrhea. The client's sexual partners should also receive treatment to prevent transmission and reinfection. If not treated appropriately, it can produce serious complications such as pelvic inflammatory disease and infertility. Clients should be taught to abstain from sexual intercourse for 7 days after initiation of the drug. Now, 2 drugs, azithromycin, okay? Mycins will never let you win. They affect your kidneys and your hearing. So mycins make your kidneys and your hearing toxic, okay? And doxycycline is a tetracycline, okay? And tetracyclines will knock you up, meaning you can't take them without extra birth control. You can't take them if you have milk in your cup, so you don't mix them with dairy. They got to be separated by 2 hours. They're not for kids under 8. They're for grown-ups.
Okay.
Just little rhymes that I use to help me remember what the drugs do and some of the side effects and some of the things that could go wrong.
So the nurse assessed a client who was 2 days.
I'm going to go on from this one because this one's really about a Jackson Pratt. And I want to do stuff that's more about pregnancy.
Okay. A client indicate the desire to become pregnant. Which of the following are important preconception education topics for the nurse to provide? So the BMI is good.
Okay. 2. Number 2. Avoid alcohol.
The folic acid is good too. 4 is good. That's it.
I don't think so.
Why dental wellness?
Yes, you need dental wellness because the baby will steal your dental wellness, okay?
Oh, I didn't know that one.
Yes, I had no cavities before I got pregnant. Well, I had one. I take that back. After I got pregnant with my first kid, I went from 1 to 5.
Oh, wow. Is it because they say some people have the water book in their mouth, or it just happened?
I think it has to do with, vitamins and the way the body works.
Oh,
It just steals, like, I guess, I don't know.
okay.
Let's see if it gives us anything up here. And plus, you don't want to get an infection, and there's certain drugs you can't get when you're pregnant. To prevent periodontal disease associated with poor pregnancy outcomes. So I guess if you have live periodontal disease, it can cause the baby to be preterm or have a low birth weight. So there's your answer.
It's a lot of things to do before you can have a baby. Okay, the emergency nurse plan care for a female victim of sexual assault. Which of the following interventions should the nurse include in a care plan? Determine if the victim has douche or a bath or shower, since there's A is good.
Mm-hmm.
Educate regarding the need for pelvic examination. Why? You all how obtain the date of the last menstrual cycle.
So I'll say 4.
And 5, because I saw that in Law and Order. Obtain the date of the last pen current. Yeah, you can do 3 too. Why though? I don't know about the pelvic examination. And I don't see the rationale for it.
So you want 2 or no?
No.
Yep.
I would have, because you are going to have to do a pelvic exam because you need to look for injuries. First of all, if she's accusing someone of rape or something like that, that's going to show you if there's trauma and stuff like that. Oh, also for collecting evidence. I forgot that part.
Okay. The precepting nurse supervisor, a new obstetric nurse performing a labor admission assessment on a client with suspected spontaneous rupture of membrane. Which action by the nurse will cause the precepting nurse to intervene? Don't answer what is it? Providing the so what happened? Oh, clear to provided the client suspected. Okay, the client client was suspected. Palpating.
Okay, before applying external fetal monitors, I don't know. I don't like 2. But let's see what your answer choice gives us.
Oh, it's 2. The one you don't like, that's the one.
Yeah, you have to have sterile
No
gloves on
sterile
for
gloves.
the exam. Especially with the ruptured membranes. You definitely are going to do that pH test, okay?
Yeah, the pH test is with 7, blue, all this nonsense. Oh, God.
I'm recording this, by the way, so you guys will be able to go back and play it back on YouTube. Once I upload it, okay?
It's good, thank you.
Have you guys done fetal heart rates yet?
Yep.
Yep.
Okay, well, here you go.
Okay, we'll be
Tracing
for.
clients.
So we don't want the prolonged deceleration.
Let me see if I can make this a little bit smaller so you can get a better picture of the 2 together. So this is 1. Let's try it again. 2. That was 1. This is 3.
Okay.
This is 4.
Okay, can I see the question again?
I'm going to let you look at the strips again, and then we're going to go back up and look at the question again.
Okay.
And then you can now go back again.
Okay, one is good. So because there's acceleration in one. And you can see the beginning, the acme, and the end is good. I like 1.
That's most concerning. That's the one that's most concerning.
That's what I'm gonna go. So 1 is okay.
1 is concerning.
There's
No,
2.
1 is okay. This is 2. 2, there's a problem with 2. But let me see the rest. 3 is okay.
I think
think
three,
4
three is
4
not okay.
4 is the most problematic. What do
Yeah.
you think, Lovetta?
Sure it's not 1?
I can't even see, like my screen is really small.
Sure it's not 1? 1 is good?
1 there's acceleration.
Okay.
So what about 3?
3 is okay. 3 you will see when it's upside
Is
down?
this variable deceleration? 3.
When it's upside down, it's still going. I don't know. I'm looking at 4, but you can go with
Yeah,
because
4.
4
Yeah,
is
4.
like a straight line.
Definitely 4. Yeah, definitely 4.
Yeah.
So 4 was correct. That is called a sinusoidal heart rate. All right. Repetitive wave-like fluctuations with absent variability and no response contractions. And it's usually an omnious finding, meaning that it could be fatal.
Mhm. And 3 will be what, Ms. Sue? 3.
3, I think, was normal. Wait a minute. Let's see if it has 3. 3 was variable deceleration.
Deceleration.
Yeah. Variable
Above
deceleration
decreases in
is
the
good.
fetal heart rate.
Okay.
Which it could be over time. 2 was early decelerations and 1 was fetal tachycardia. Okay, you guys did good on that. Better than me, because I don't do the fetal heart rate things, man. I can't get them things. Okay, the nurses.
We have no choice.
Sorry, you can read, huh?
I said we have no choice.
I know, right?
The nurse is caring for a client in the first trimester during an initial prenatal clinic visit. Based on the information provided by the client, which factor placed the client as an increased risk for preterm labor? Periodontal disease. So we can eliminate age 25 is okay. White ethnicity, no, that has nothing to do with it. Vegetarian diet, protein. I will go with periodontal disease. What do you think,
3?
Roberta?
I will go with 3.
Okay.
Let's see.
You think it's going to be vegetarian diet? So I don't think a vegetarian diet alone, as long as they eat the things that they should.
Okay.
Yeah, periodontal disease, yeah.
Disease. Okay.
Okay, I just picked that on purpose, but you know, that's the reason being why. Okay, Hermesis, let me go over with you with your book real quick.
Okay.
And And I'm going to try to see
Okay.
what I can do to arrange my times a little bit different so I can set you guys up so you can get a good 2 hours. I really don't like to do tutoring sessions less than 2 hours because you see, we spent 2 hours here and it goes so fast.
Yeah.
Okay, so can you do a screen share with me?
Okay, share.
Let me stop my share first.
Are we done?
Yeah,
with
we're
the
going to be done for
questions,
today because I
Mrs.?
got to get out of here.
Okay.
I'm at the school, so I got to close up shop.